I welcome you all to MOOC's course entitled Community Engagement and Social Responsibility. I will be discussing Unit 5 today, entitled Research and Innovation in Community Engagement Related Issues. This unit has two modules. The second module is about rural distress, rural poverty, impact of COVID-19 on migrant laborers, and mitigation of disaster. Module 2, Part 6. In sixth part of Module 2, we will be studying about case of migrant workers. In the previous part of the module, we studied measures of poverty alleviation.
We have a case here which shows a recent case which has demonstrated, despite of many norms, despite of many reforms available, rural areas had the highest hit due to COVID-19. That means COVID-19 has aggravated the problems of rural distress and hence led to the rural poverty. So how does it happen, when if we were talking about people are switching themselves from agriculture to other operations, they are working as migrant workers in the urban areas so that they can sustain their lives. So this again created a condition where they were jobless, they were unemployed, they were suffering from the effects of the pandemic, and then they were seen to be uh, drowning in the vicious circle of the poverty. So COVID-19 brought migrant workers and their means of livelihood to the government's doorstep, even though the cities and the countries which are established there, the rights and entitlements of the migrant workers were ignored in the policies and programs, which says what would happen if a disaster of such kind comes again? What are the policies for migrant workers? Because they are dependent on for their livelihoods on those particular tasks. So if there are lockdowns, what will happen to them? Policies are required to be there. Indian urban development and planning strategies and programs have hardly implemented any particular programs for them, for migrants. Reasons for the increased effect of COVID-19 on migrant workers were that there are no set policies and programs by the government for them. Being the established country or being the established city, there are no norms regarding them. Again, there is no particular program that how migrants would sustain if there is no work available. So there are suggested solutions to mitigate the impact of COVID-19. Solutions are in the form of that Government of India and state governments as well as non-government organizations, that is NGOs, and benevolent societies can come together and provide variety of measures so that they can help themselves to sustain during the odd times. Long-term plans should be put into force to address the problem of food and nutrition. Daily workers, migrant workers, their families should be fed with the food grain and supply of food grain and other necessity items. Now, what can be the solutions to such kinds of problems? How can we mitigate the impact of COVID-19 on the lives of the migrant labor, specifically migrant labor, because they form they form a prominent part of the rural areas. So the policies can be that Government of India and the state governments, the NGOs, non-government organizations, and benevolent societies can come together to help the migrant workers to sustain their lives. Long-term plans should be developed. We need to focus that for a long-term development, if we have a long-term plan, the migrant should be considered as a stakeholder in the policies. He should be considered as an important part for the development of the economy. To address the problem of food and nutrition, Plans for providing the food grains, plans for providing basic necessities should be there in place when such kinds of disasters appear. So again, further how such risks can be mitigated. The government should study and implement recommendations of UNICEF, UNESCO, and the Working Group on Migration. The policy matters can be referred from such documents. Public health system should be strong so that any case if there are problems of such kind, those can be addressed. Investments should be expanded. Investments in healthcare sector, investments in providing the employment to the migrant workers at their homes should be looked upon as a policy. And to tackle the threat of environmental degradation, global warming, climate change, epidemic and pandemic diseases, climate resilient societies must be developed. So now it's the time to think on whatever is a disaster we should be able to evolve from. And such a disaster is resilient plans would help the community to alleviate themselves from the vicious circle of poverty and the distress. So therefore, there comes the role of community engagement. We should not forget that how these problems can be resolved altogether if the community is engaged in the research of finding solutions to these problems, then definitely we'll have a better community, a community which will exist for a number of years, which will have a positive impact on the lives of the nature as well.
So, in this part, we studied about case of migrant workers. With this, we come to the end of module 2. In this module, we studied about rural distress and causes to rural distress. We also talked about the consequences of rural distress and suggested solutions to it. The module also reflected on the problem of rural poverty and how it can be alleviated. We undertook the case of migrant workers to understand the concepts and applications of solutions.
So therefore, I would like to conclude uh, today's discussion. We have talked about rural distress, which is a form of a vicious circle which needs attention. Structural reforms can help the rural poor to come out of the rural distress condition and to save them to drown in the rural poverty condition. Price reforms are not sufficient. Structural reforms are required to be focused. Risks of epidemics, pandemics, climate change can be mitigated with collaboration of rural and urban communities, with collaboration of institution and industry partnership and community engagement programs. Thank you all for joining.